slowish time. Yeah, there you go. So what I've done here, so T1, T2, T3, T4, T5, T6. I've marked on this one, just with green. So it doesn't matter if it's on this side or this side. Let's say, for instance, you believe T6 is fixed closed on T7. So when you've asked the patient to flex, there is less gap here compared to, say, this one or this one. So you've done some motion testing, it's a bit restricted. You've done some motion, here side bending, some rotations. It's feeling a bit easier, but it still feels there's a restriction in here. So you think, okay, so let's go for a manipulative technique. So if you're going to do this now, you don't have to do it. If you don't want to do it, you don't have to do it. And you don't want to have it done because you feel there's something going on with your spine, etc. Don't have it done. Just step back and just go, I prefer just to watch this bit. Yeah, okay, you're an adult. It's only 1 day course. It's not much of a commitment. And that's just the way it is. So, but if you want to do it, yeah, this is the next bit. But if you're going to do it and promote treatment on your websites, spinal manipulation, yeah, etc., then obviously you need the appropriate insurance for that and get the patient to sign accordingly. Now, grade 5 technique, yeah, for you, but then I call it a HVT. So I call it a HVT, high velocity thrust. Naturally, the chiropractor would call it an adjustment. Not many chiropractors learn it this way because they would normally do the supine way, which I'll show you afterwards. When we do use the towel, there's no cost really. Yeah, you've all got these towels. You know, if you do like a shockwave course, you end up buying a shockwave, and you know, if you do ultrasound, you buy an ultrasound. Whereas manipulation, if you can't do it with your hands, you can't do it. It's as simple as that. I know some cars use like an activator. If you've seen them, it's like a little preloaded gun. Okay, so it's like a, you know, you can different settings. I use it for horses as well. So you can literally apply it onto part of the articular pillar, they might call it here, and they use it and they go, okay, and then it's the sort of articular pillar. Let's say the TP is not quite TP, you can do, and it changes the vertebral position. Good things from the activator. Use a towel, roll it as tight as you can get it, and then when you roll it, the towel is going to be placed on the level below. So if you've got 1, 2, 3, 4, 5, 6. So if you're going to cavitate T6, 7, the towel is going to go onto T7 because it's going to fixate the level below the vertebra you are manipulating. A lot, you know, every day I get loads of emails on YouTube saying, you know, I can do that, but I don't need a towel. And I go, and I can't even be bothered commentating, okay, because it just goes on, and I got better things to do in my life rather than answering questions like that. But, which is fine. The rugby lad, okay, with his girlfriend can just lift and squeeze her, and he goes, do, do, do. But he doesn't know what he's doing. He doesn't know that it's a T6, 7 or T5, T6, okay? He's just doing it because he can, all right? You know, he bear hugs his girlfriend and she goes click, click, and she quite likes it, okay? Then she gets her girlfriend to come along and she click, and he clicks her as well, and now he says he's an osteopath, all right? So, okay, but the idea is that we specify the level. We're only trying to target that level, not a level above it or below it, just one level. Now, when we do it, we have to set up things in the correct way. The height of a couch is one. Yeah, obviously, you know, I start with maybe a patient where they might cavitate a bit easier than maybe if I tried maybe Ali to start with, because I might have to use a little bit more effort. And because you see me using a little bit more effort, you naturally see that and you think about it next time with your patient. Whereas if you see me hardly use any effort and I can cavitate it quite easily without any force, you think, wow, you made it look so easy and quite gentle how to do it. Okay, and hopefully you remember that. When I do it, I normally do the technique once. If it doesn't cavitate, I'll do it twice. And if it doesn't cavitate on the second, that's me done. Okay, I don't do a third and a fourth. First, yes. Second, maybe. Third, no more. Yeah, because I'll be irritated and the patient's protected. Yeah, so I always start off lighter and then increase from there. So the patient is going to sit right back to there. Yeah. The height of the couch, they're all slightly different. Some of you are taller, some of you are smaller, so you might have to just play around with the height of the couch. If you can't see, I'm going to have my back to you, some of you now. So I'm going to be, is that couch hard? It isn't. Is that high?
Yeah, high.
Yeah, let's go that one. Okay, so I might as well do it in a way I would. Most of you will have electric couches, hydraulics. So it's a bit higher. Again, if you can't see, if you want to film it, come round. Now, so let's say for instance, have a go first around T6, 7, because it's the easiest one to learn. If you said, oh, can I do T9, 10 first, you would struggle. If I want to do T2, 3 or 3, 4, you will struggle. Because there's a change of position. So try the middle one first, and it's also, there's no real contraindications, there's no real spinal pathologies here, so the chances of causing a problem is close to 0. If you start in the lumbar and you've got stenosis or this condition, it's a different story. Yeah, we'll come on to that later. So start around the middle and you should be a lot safer, yeah, than you would start in different places. So using the towel pretty tight. Sometimes the towel will absorb your effort. So make sure that it's almost like, just think about you buy 10 bin bags like from Sainsbury's and you think, wow, that's firm. So it has to be as firm as you can get it. If it's too soft, when you pull, the absorption is through the towel and nothing really happens from there. Where I manipulate, I guess for a man it's probably easier, for a woman, potentially, because men, yeah, we don't tend to have things in the way. Just trying to think what words I was doing, that.
Boobies.
Yeah, boobies. Yeah, just boobies in the way, yes. Okay, so for a woman with boobies, then you can put the towel in, come under, come over, come to side, yeah, that sort of thing. So, I'm not going to say anything else about that. I was going to say joking, but I'm not sure if it's appropriate, that one. So I'll leave that one for now. Yeah, I'm going to tell it. Yeah, so a doctor friend of mine, he said, and it was a true story, this one, okay? And he was laughing as he was saying it. And he said, oh, this woman like come into the clinic, and she's an older woman. And he said, and she said, oh, would you mind having a look at my breast, because I have a problem with it. And he said, yeah, it's okay. So, and she literally just sat there just under the blouse, but she literally, she kept her boobs in her pants. Okay, so she kept them in her pants. So she had to lift one out of the pants and show him her boobs. So her boobs were like that. Okay, and I always tell this joke to my mum, and she used to hate it. I said, Mum, is this you in the morning? Put your bra on. Anyway, that's enough of those jokes.
You men have no idea.
We don't. So anyway, back to the professionalism of manipulation. All on video. Right? Yeah. So height of the couch, patient come back to you as far as you can, that's fine. So you are not going too far forward. So if you get these things right to start with, that's why I spend a bit of time on this, because it's the first one you do, and you have to get it right the first one. Okay, then it puts you in a good stead for the second and the third and the fourth. So just take your time doing it. So roll the towel tight, apply this around, let's say, T6, 7. Now from here I'm going to drop my sternum down to that level. My one leg is forward, my one leg is back, you see that? Now with my patient I'm going to go right arm under left, and I'm going to pull her arms onto the back of her shoulders, like this. Be careful where your hands are going here for obvious reasons. So one hand on one elbow, you can't see me here, and I'm going to flex my patient down until I feel tension to that level. This hand now comes onto the elbow, so I'm in this lunging type of position, and then from here I'm going to slowly pull my patient. I'm not going to do anything yet. I'm going to pull my patient, pull, and at the same time I'm going to push with my sternum. So this would be where the chest to draw is locking. So this would be the setup. This is the 1 to the 9. Okay, the stages, okay? The 9 to the 10 is what I'm going to do next, which is where I cannot teach it. So when I do this technique, typically I'll say to my patient, she'll breathe in, and as she breathes out, I will pull, I will push, I will lock, and then I'll do a quick thrust motion. Now, the thrust is not very far, but the speed of execution is quick. Okay, so from there, I literally just do this movement. And it's an equal pull as you push. A lot of people will struggle with it, some people will get it straight away. Okay, but it's that concept. I think they call it an AP thrust now, I could be wrong. I call it a thoracic thrust, because it's how it's taught to me. So from there, you are pushing T7 anteriorly as you try to pull T6 posteriorly. So an AP thrust. Yeah, some people might call it PA thrust. Yeah, so from there, I'm not sure what physio would call it. So from there. So once you're in that position, I would normally say, are you okay for me to do this? Yes, and she would sign something. Yeah, so make sure you get consent before you do it, because it could be a problem. If everybody's happy, and she's happy to do it, then I'm going to go through with it now. So, let's go back to where we were. So let's find the position. So T7, come across, use the towel to come onto T7. So I'm going to go right arm under left is my preferred way. It doesn't mean it's the right way, it's my preferred way. So hand on the elbow, so I'm going to slump it down. I'm going to do it, okay, because I think it went a bit too far. So flexor until you feel tension into that sternal area. Don't over flex, don't overlock, just flexor initially. Hand onto the other elbow and you slowly start to pull back in here, okay? Take a small breath in. And as you breathe out, lock, lock, lock. Oh, and no release on that one. Let's come a little bit lower. Now if it didn't release on that one, let me just go a little lower. If there's no release on the second, I'm going to try somebody else. So take a small breath. And breathe out, lock, lock, lock.
Oh!
I heard that.
Okay. With the first one,
Was that a release?
with the first one, I didn't try it the second time. The reason why I didn't try it a second time, because when I did it, I felt it move. And I felt it wasn't going to cavitate, and I thought I don't need to do it a second time. If I felt it was stiff on doing it, I would have done it the second time. But that just comes with lots and lots and lots of practice. Okay? So I thought I would just go to the one bit. Remember I am assessed her. You would be assessing all your patients. So you'd be saying, I believe T6-7 is fixated because of my testing. And then when you do a towel, it's more likely going to cavitate because you've assessed it. Okay, so I'm just showing you the one that I normally start off, even though I didn't assess it. Okay, so I actually just went to T7, T8. Just a little bit more flexion, and I did the same technique, and it cavitated quite nicely. Okay, but yeah. Now, if you just turn around, Paula, for a sec. When you see me do this, I'm not going to use a towel just for the demo. When you see me do it, you think you see me do this. Two things. Now, from there, look at the elbows, okay? So, the first thing you think you see me do, I apologize, Paula, for this. So, with the elbows, you think you see me do this. Okay, listen to the out breath. Okay, she didn't like it. Okay, it's not very nice. Okay, so we don't pull the elbows down towards the chest. We don't do this. The second thing they don't like, look at the elbows. We don't do this. Okay, look at the elbows. Okay, okay, they don't like it. They don't like any of it. And the thing is, with manipulation, if you irritate them twice, you'll never see them again. All right, because they worry. They go, you can do that technique you did last time. Oh yeah, do you like it? Well, not really, but they won't say that. All right, so if they don't like a technique, they don't tend. So you have to say to them, was it okay? Did you like it? You know, was it beneficial to you, etc. And if it wasn't, and you irritate, you won't see that patient again if you irritate them twice. Okay, trust me. You know, I've taught 100,000 therapists. I know. I get the emails from all my therapists. So when you do it, the technique, elbows, you are pulling to your sternum. Okay, so it's a direct pull there. Not down, not out, not up, because they're little and you're big. Okay, and you lift them up. This is the other things I see, like, John, what's going on? Okay, let's just change those techniques, shall we? Yeah. So you'd almost want to not see it happen. So from there, it's not gonna happen anyway. Okay, so from there, take a small breath, and as she breathes out, lock, lock, lock.
I didn't, sorry, for a second.
Okay, yeah, so as she's breathing out, I'm not doing it because I've got the towel there. So from there, lock, lock. And I'd almost be doing it like this, okay? Where you wouldn't really see it. And that would be the skill, is where you already see it. Oh, I missed it, okay? Whereas if you've got loads of range of motion, you go to the chest draws in and you're trying to hope for the best when you pull it out. So when you feel the bind, there she is. Little motion, but fast. First one's the hardest. Yeah, first one's the hardest. Have a go. I'll watch you all go.